Thank you, Madam Chair. This may be areas that we have gone over a little bit, but I am concerned that the pandemic has exacerbated disparities in the physical and mental health of our children, as well as their academic and developmental growth. And I wanted to ask both Dr. Beers and Dr. Evans. I know, Dr. Beers, you're a pediatrician, you're not an education expert, but you're a child mental health specialist. And in this capacity and from your experience and leadership with the American Academy of Pediatrics, what do we know about how the pandemic has affected adolescent development and academic achievement, and whether this will be long lasting? Dr. Beers.
Yes, no, I got it. I knew I was going to not hit it once. Thank you so much for that. And yes, I do, the effects on children over the past 18 months have been really substantive. It has impacted their mental health, it's impacted their education, and those impacts have not been equitably distributed. I think children who are living in low-income families, often children in communities of color who may have children who have experienced greater amounts of grief and loss are impacted more. We're hearing this from our pediatricians across the country. I do actually do quite a bit of work in mental health systems here in Washington, D.C., and access to mental health care for children, and we're seeing that here too. I think in terms of recovery, I think we can recover. We know that children will thrive with safe, stable, and nurturing relationships. We know that with good supports, they can recover, and I think it's incumbent on us now to make sure we're putting those supports in place to make sure our children get the things they need to address all the concerns that have risen here today.
Maybe Dr. Evans, I'd ask you to respond to the same general question. Has the pandemic affected the development of our children from a mental and behavioral standpoint, and whether we know if this is a long-lasting problem?
Yes, well, we know that the pandemic has had a big effect, but one of the things I want to stress is that it's not just the pandemic. We talk about a syndemic because we have the financial, the political, the racial justice issues that have been raised, particularly for Asian Americans who've been discriminated against and African Americans who experienced the summer last year. So it's a number of things that are impacting on children. And the one thing that we know, number one, is that children are resilient. Children are going to be able to bounce back. But we as adults have to do and implement policies that help that to happen. We believe that we have to take a comprehensive public health, population health approach. We have to have effective and efficient clinical services for children who are experiencing significant problems. But we also have to move beyond that and start looking at children who are at risk. We know who the children in our communities are who are at greater risk for having behavioral health challenges. The problem with the way we've dealt with behavioral health is that we wait until those children have crises before we intervene. We have to have more funding and more resources to identify those children early on and to intervene in ways to reduce the risk, or at least to intervene early. And then finally, we have to make sure that we are doing everything that we can to build resilience in children, keeping children healthy and safe. We know from a lot of psychological research what are the factors that are related to psychological health. We need to make sure that teachers understand that. We need to make sure that parents understand that. We need to make sure that we have programs that build resiliency in children to do that. So, and one other thing that I think is really important, we know from studies that look at disasters like 9/11 or hurricanes that for children, the symptoms may last from 1 to 4 years. But the other thing we have to realize with children is that the kinds of harm that is happening really affect the trajectory of their lives, and we really need to be thinking longer than 4 years in terms of our sustained efforts at addressing their needs. And so that means we need to be building the infrastructure today. I'm very concerned that we are using one-shot temporary funding when what we should be doing today is building the infrastructure and the workforce and infrastructure and programs that will last over the course of how these children will experience these problems over the next several years.
Doctor, let me follow up on that, because what I'm interested in is you say we should direct more funding to this issue for early kind of intervention and support. What would be the infrastructure that we would fund? Does that exist today? There's existing sort of things we should be funding, or would we have to create something new for that?
I think it's both. There are existing early intervention and prevention programs, but we don't have nearly enough of those resources. You know, 95, you know, I was a mental health commissioner for many years, and in most systems around the country, 95% of the services dollars that commissioners like myself have are directed at treatment. Treatment, by definition, is a reaction to something that's already happened. If we really want to get ahead of this, we have to have more resources for prevention, early intervention. We have to get upstream. And one of the big problems with the way we've dealt with children's mental health in particular is it is very reactive. If you ask the typical parent about getting their child the
Doctor,
services they
my
need.
time has expired. I'm gonna,
I so apologize,
my time's
Dr.
expired. I appreciate that very much, and Madam Chair, I yield back.